Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It's very different than scoliosis as a child. It's often painful, it's often stiff, so it's not flexible and it doesn't respond to bracing, and it often leads to both back and leg pain. There's two reasons why adult scoliosis occurs that we know of. One is if you have adult scoliosis as a child or adolescent and it's 40 degrees or more at skeletal maturity when you stop growing, it typically gets worse at 1 degree on average per year, which doesn't sound like a lot, but when you get to be, let's say you're 20 and then you go to age 70, that's 50 plus 40, that's a 90-degree curve. That can be a lot. The other way it can occur is due to new spinal degeneration. So you don't have scoliosis as a child and you start to get degeneration in one or multiple discs. That degenerates and pushes forces back to the back of the spine in the facet joints, and you can get arthritis there, and it gets asymmetric, so one side worse than another, and then it starts to get a curve. And you can start to pinch on nerves as well as having the spinal arthritis, so you get back and leg pain. So the symptoms: the arthritis from the facet degeneration can lead to very significant back pain. It can be disabling, actually. It can also include muscle weakness and aching from difficulty standing up straight, so you're having a tough time seeing the world straight, so you're having to flex your muscles to get to that point, so it can be very tiresome. It can also lead to buttock and leg pain from the spinal stenosis as nerves get pinched. So think about it. Here's a curve. It's wide open on these disc areas here, here, and here, so the nerves coming out are not getting pinched. But here, see the concavity? Nerves that are trying to get out are getting pinched because of the decreased space available. So treatments include over-the-counter medications such as anti-inflammatories and Tylenol. Prescription medications may include higher strength non-steroidal anti-inflammatories, neuropathic medications such as Neurontin or Lyrica, narcotic medications, and then topical pain creams or patches. Physical therapy and chiropractic treatment can be of benefit along with interventional treatments. So interventional treatments, there are quite a few. One might include facet injections where the needle goes right into the arthritic facet joint, and that places the steroid and can lead to pain relief for weeks to months. Trigger point injections, which would be more back here in the muscle where the muscles are aching, that can help considerably with the spasms and weakness. Medial branch block, which is what you see here, which is where steroid or numbing medication goes around the joint but not into it, and it can block these little sensory nerve endings from causing pain. Okay, average pain relief with those is 3 months. If that works and the pain relief wears off, you can go on to have this, which is a radio frequency ablation, where it's actually a catheter, goes into the same area as the medial branch block, but it heats up those little nerve endings and basically deadens them, and that can provide pain relief from anywhere from 1 to 2 years, and then you can repeat it. So it's been amazing. Epidural injection is where steroid goes to the area of where the nerves are getting pinched, and that can help a lot with the buttock and the leg pain. What are the outcomes with non-operative treatment? Well, over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain and avoid surgery. All right, so just because your back looks like this is a 70-degree curve, you don't necessarily need to have a procedure like this. This has over a 65% complication rate, from large to small complications, and if you can achieve the same amount of pain relief without it, then that's great. Surgery is elective, it's quality of life, and it should be a last resort. The surgery involves both a nerve decompression and fusion, high complication rate, 6 to 12 month rehab rate, and adults just simply do not tolerate these types of surgeries like you do as a child. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.